Hello, welcome to the video of a day in my life. As you can see that I'm on the beach. I've changed the format a bit and I'm using some headphones and I hope the sound's a bit better. But I'm showing you my life as a medic for nearly 40 years in a hospital-based practice and as a consultant surgeon for 25. So if you talk to other doctors, and you may have some in your family, they'll have a different perspective, but I'll share you mine. Plastic surgery. Hang on. Isn't that another name for just a cosmetic surgeon? Hopefully I'll show you that it isn't, but I'm also being really careful to reduce any graphic content so as to not upset any sensibilities. So I hope that's okay. And then if you don't want to look, you can always look at the beach. I've been lucky enough to work in the UK and spend working practice abroad too. So there are a mixture of images from different parts of the globe. The word plastic surgery, the term expression plastic surgery, is from a Greek word plastikos, which means to form or mold. And this picture here shows a kind of punishment that was meted out to felons in India, where the nose was cut off, and a surgeon worked out that you could take a piece of forehead, the shape of a leaf, and spin that round on its axis just to cover the nose as a flap. And what they didn't realize at the time, or may have not known at the time, is that there was an artery within that called the supratrochlear artery, and that artery was enabled you to keep that forehead flap alive. But what was really cool about it is that this was thousands of years ago, and what's I love most of anything is that there's no specific territory, and we're using the same techniques that we used then to resurface defects, for example, on the nose, and this is the finger forehead flap, exactly the same principle on the same blood supply. And what's really made a difference for us as medics and as users are devastations like the wars, where anesthesia, resuscitation, psychology, psychiatry, and surgery gets driven by the immense number of injuries that come from conflict. And our modern day conflicts are the fight that we have against having to reconstruct after malignancy, trauma, and burns. The term or the expression surgery to restore form and function and to promote well-being is pretty well what I do, or what we do as plastic surgeons. And it's a massive palette. That's what's so lovely about it. Breast reconstruction is a discipline on its own, and 1 in 9 women will potentially get breast cancer. My interest was in hand surgery, tumor and trauma, and so I had a pediatric practice, a children's practice with all sorts of congenital anomalies, some of which don't need treating, like this child, because they've got a perfectly good form and functional hand. Arthritis, osteoarthritis, degenerative diseases, and so on. Burns, paralysis, gunshot wounds, improvised explosive devices. All the conflicts in the United Nations will have injuries that will be seen not just by plastic surgeons, but general surgeons, orthopedics, and so on. So it's just introducing you to the kind of practice of my day. We have the highest incidence of skin cancer right here in the UK and the southwest of England for a number of reasons. Car accidents, car crashes, motorbike injuries will involve multidisciplinary specialties, of which plastics is only one. Cleft lip and palate, craniofacial surgery, and we have anesthetic surgery. It means that you get to go all over the body, all genders, in adults or children. And just some illustrations, if you're not sure what they are. This is a cleft lip and a cleft palate, unilateral in a young baby. And this is a small skin cancer, the commonest sort of cancer that we would see in the world. It's called a basal cell carcinoma. And they're very treatable when you take them away. So that was my interest: hands, breast reconstruction, and these things called sarcomas, which are soft tissue growths and injuries and trauma. Why I love hand surgery is because it's an ever-changing field, and that our limb buds just grow out from, if you like, our trunk. We're like cylinders, and we grow these little buds, and they start to form within the 5th to 8th week of intrauterine life. And by 8-10 weeks, we're very fully formed in the hand. It's absolutely beautiful. And sometimes a series of conditions prevent normal development, and you can get all sorts of very interesting and complex and challenging hand anomalies to deal with, and obviously for the family and the parents and the siblings and so on. And this is an image on a scan of somebody's thigh. And this is a longitudinal slice of their thigh on the scan with some fat. You can see some muscle. And here you can see a soft tissue sarcoma that's needs to be taken out and biopsied and so on. So that was kind of my working life, my working practice. And my day would typically start at about 6:30, 6:45. I'd get up, do the things you need to do in the morning and go to work. And I was holding down 3 jobs, an NHS consultant practice, working as university teacher, and my own independent or private practice, where you still see patients, you still do all the things you do in your NHS, but in your own time. So I'd start off at work about 8 o'clock, depending on the day of the week. I might have to be involved in emergencies that had come in the previous day and see them with my junior doctor team, who are all fantastic and were learning. And you would then do a trauma round, or I would start seeing my patients and consenting them before my operating list at 6:30. And again, I'd have trainees with me, because the whole basis of what you do is to pass on your knowledge and to promote and develop the next generation of medics. So with myself, my colleagues, my anaesthetist, my anaesthetic, uh, um, the anaesthetic trainees and the scrub team, and my junior doctors, we'd be, for example, in an operating list until lunchtime. And then if we had an afternoon list, we'd carry on, or we might have an afternoon clinic. We then finish up with a post-op ward round. That's me operating here, but again, I've taken all the gore off the slides. And then lunch is really on the hoof, and it's whatever you can get your hands on pretty well. It's a good way to stay slim. And then I would finish off my post-op ward round, see my patients, and then carry on with doing some admin stuff, letters, x-rays, reports, and so on, deal with any correspondence. If I hadn't been able to do it during the day, that's the time I'd do it. And then I'd get home relatively, summer it's fine, in winter it's a bit miserable. And then I would have a dog that always needed walking. So I would walk the dog, have my dinner. That's a dinner off the internet. It's variable. And then I deal with personal stuff, personal emails and my university stuff outside the NHS. And then I'd potter about, sometimes with Harry Potter and co, and watch a bit of TV and then head off to bed. What I love about my life and my job is the variety, and you have to be fairly versatile. And these are some pictures that I've just thrown in there of microsurgery, looking under an operating microscope, looking down at vessels that might be 1, 2, maybe 3 millimeters if you're lucky. And if you know the blood supply, you can join the arteries up, you can join the veins up, and it's just fantastic. And you can lose yourself repairing nerves, repairing blood vessels, the finer structures in the body so they can still flow. And I've only been scuba diving once, and I remember that sensation of being free and just looking underwater and being totally focused and immersed as what I was seeing. And it's very much like that. The beach analogy is good now. And the other joy for me is working with colleagues, and this is one of my colleagues who's an orthopedic consultant who's teaching some trainee doctors and students how to do a hip replacement. And you, as a medic, this is to illustrate that you are, as a teacher, you're spending your time teaching, you're training, and it's very much on the job and sharing your knowledge and being challenged by your trainees to say, why do you do it that way? Well, I've seen other people do something different, or what's the evidence for what you're doing? And it makes you question yourself and change your practice, and that's really important. And these are some of my fantastic trainees who were awesome. And this was at the Royal Devon and Exeter Hospital, just as I demitted from that post. And they made me a cake, and they made me a cake of somebody's hand. It's all edible. The icing's edible, the surgical instruments are edible, the clot is edible. It was raspberry flavored. I just thought it was awesome. So I'm very lucky in terms of my job and what I do. So I've carried on working as a consultant and at the moment in independent practice. I teach clinical anatomy at Exeter University. These are some of our students who are learning on a suturing skills course. how to mend wounds. And I have the joy of working with fantastic students from all through the different years, and they set up a conference called the Southwest Plastic Surgery Conference. So my day-to-day life is going to be very much dependent on not my clinical practice, but the sheer, undiluted, unbridled gratitude and affection for the learners that I work with and my colleagues. We have resin preserved cadaveric tissue at Exeter, and you can see I have an affection for these very, very kind and gracious donors who've allowed us access to their preserved bodies. It's just a joy to be able to teach with authentic tissue as far as possible. And to such an extent that it seems a bit weird that I hang about with body parts, but for my birthday, for my 60th, I was taken. I've concealed my wife because I thought it was unfair for her if she didn't give me full consent. She took me on a secret trip to the Body Worlds exhibition in Piccadilly Circus, and if you ever get the chance to go, please go. It's absolutely amazing. It's pretty mind-blowing. Why I had a unicorn headband and a mask, I don't know. I know I had the mask because I was blindfolded till we got to the place because I wasn't being told where I went. You see so much stuff in the news about junior doctors, their work-life balance, the difficulty about taking time off for health reasons, for overstressed rotas, of under-resourced hospitals. We've got the issues about PPE at the moment. Things come and go, and I think it is still a fantastic, awesome time to be a medic. We'll always need medics, anaesthetists, psychiatrists, counsellors, surgeons. This is the Grenfell fire that happened in 2017, and there are conflicts all the time in the world. That was at the Boston bombings, where at the marathon. Sri Lanka from last year, just in London. We know this happens, and I just want to be clear that I'm only giving you an idea of my working life and practice because I'm one of several specialties, and anaesthetists, I've put on in here forensic pathologists, general surgeons, orthopedic surgeons, and so on, neurosurgeons. We are a team. And the whole idea of medicine is that you are very much part of a huge medical family and nursing family, and we share very much with allied health professionals what we do. Our students graduate, and so my university life involves being able to go to some of the graduation ceremonies. There's Wally at the back, and then when I had a picture, one of my colleagues, who's one of my teachers, she's great because she photobombed the picture, and I've still got my shades on, which is really a true indication of a Wally. Wallies also injure themselves. I tried to do a backflip off a wall unsuccessfully. Oh, well, at least I didn't break anything else. I had some screws put in. The point about this is you can't always predict where you're going to go in life. And I haven't given you a lecture on plastic surgery because that's not the purpose of this, but it was just to show you a flavour of having to deal with the unexpected. And that's very much what most days in medicine involve. And that phrase, when life gives you lemons, make lemonade. So the two things that I'm known for are shades and beanies. So if you come to Exeter, you have to put up with that. Thank you so much for listening, and I hope you've just you get something from this very short narrative. See you soon if you're coming down. Take care.